We see the changes of policies in China concerning Omicron. So how do you see this process?
The shift of the policy is towards giving more resources for protecting especially those vulnerable population, older population, and to flatten the curve. So I think that's the most important thing. So those institutions set up during the pandemic, like the health code and the other APPs, may no longer be the attention being paid in order to prioritize those resources for more vulnerable population. So I think that there's a shift in the policy focus.
And most importantly, they need to educate the general public to explain the rationale of the new measures, and also to vaccinate the elderly very quickly, and also to stockpile effective antivirals, and most importantly, to protect the hospitals from collapsing.
The U.S. is in a unique position of having a triple-demic, that we have COVID, we have seasonal flu, and we have RSV, respiratory syncytial virus, which mainly it makes newborn babies and particularly preemies ill, but also can make elders ill as well. But one of the crises that we have in the US is due to COVID and the need for more adult intensive care beds. Many hospital pediatric intensive care beds have been converted to adult intensive care beds. And so there's a huge shortage of pediatric intensive care beds. We're having a pretty bad flu season. You know, it's spiking much earlier in the year. And we've seen COVID going up since Thanksgiving, and we're now going into Christmas and the New Year. So we expect to see it grow even more. There's still over 400 people dying a day from COVID in the US, over 65,000 people testing positive, but we know that's a gross underreporting, and about 35,000 people in the hospital every day from COVID.